So we started looking into the possibility and the feasibility of building a healthcare center in the area of Deborah Burhan. Donna obviously talked to the right people because last year in the summer she was contacted by John Osterlin from RI, and he asked her to put together a team to go to Ethiopia to do a needs assessment for a health clinic. The team that went included Donna, Mike McCullough, Mike Duben, myself, and an Ethiopian fellow named Bieni Haile, who's from the village of Deborah Burhan. I want to start by telling you a little bit about the current reality in that area. Mike's then going to tell you about some of the first steps that we've taken, and Donna will tell you about the next steps that are to come. We're very pleased, first of all, to say that in Ethiopia, the government has a really strong commitment to healthcare. They've built nearly 800 new health centers over the last several years, and they're training more doctors and nurses to work at these health centers. Unfortunately, though, there are still some areas that are very underserviced, including Deborah Burhan. The smallest unit of healthcare, just to give you a little bit of an understanding of their healthcare, is called a health post. And at a health post, they have one extension worker who's just a person from the community who gets about a year of training in the area of the medical field. A healthcare worker, though, a health post worker, the extension worker, only does prevention and education, though, and no treatment is available for any type of medical ailments. A health post serves 5,000 people in a community. A health center is the next unit up. It's a multi-block center. It serves 25,000 people. So where there are 5 health posts in an area, there should be a health center as well. And then hospitals are the largest of the units of medical care, and they're in the urban centers, and they serve more of the serious issues. So Deborah Burhan is located in the northern part of Ethiopia in a region called Tigray. It's about 9 miles west of a major city, about 60,000 people, called Axum. And there are about 5 kabeles or villages in that area. It's one of those 5 that is without a healthcare center. In this region, the primary medical concern is maternal health. Many women are not able to get to a hospital or to a health center in order to have their babies. They can't do that because of the long distances that they have to travel. Other medical concerns are respiratory infection, pneumonia, malaria, dysentery, acute fever illness, trauma, skin diseases, parasites, eye disease, and TB. When you see the conditions in which the villagers live, it's easy to understand why these ailments are so common. Clean water is not readily available. People share their homes with livestock, and it's not uncommon to see goats and chickens in the living spaces with people. Respiratory ailments are also common because their cooking is done right in their homes, in closed-in areas. And yet with no healthcare center in the area, the villagers from Deborah Burhan have to walk about 2 hours to access any medical care at all. The only medical service that they do have in Deborah Burhan is a health post with one extension worker, again, who only does education and prevention, no treatment. In Deborah Burhan, when we spoke with the extension worker, she told us that in the time from January 2014 until August when we were there, she was aware of 860 pregnant women in that region. More than half of them had their babies at home, not in a hospital or in a health center. Of those 445 women that delivered in their homes, 3 of them died during childbirth. And then other medical issues, we had 11 children in that area that died from malaria, and 13 people died from dysentery, which are all very, very preventable. And that was just in the first 8 months of that year. I'm going to turn it over to Mike now to tell you a little bit about some of the first steps that we've taken.
Thank you. Good morning, everyone. So our team was sent over there to do a needs assessment, and really what we were asked to do is look at whether or not a health center was needed, what sort of medical center would we build, what the scope of the project would be, what the cost of the project would be, and what kind of partners we might be able to put together to help us with the project. So using our contacts from our previous work in Ethiopia through Relay, we were able to meet with a bunch of local and regional officials to find out what the current levels of service in the area already was. We learned a lot about the demographics in the area, and we also were able to confirm, as Shelly just mentioned, what some of the prevalent medical needs were. What we learned is that in Ethiopia, first of all, the federal government has been working quite hard in terms of developing medical centers all over. It's just unfortunately in the north they haven't been able to provide the same level of service. So the standard medical center has about 6 blocks in it, and it didn't matter what sort of site you went to, they all look the same. We were fortunate to do 2 site visits. And at those site visits, we determined, we went to one actually in Axum, and we also went to one in a village north of Axum. And we were reassured to find out that everything everyone told us when we met with them was exactly what was in place in the site. So I think we walked away from our first couple of days realizing that they really had a good idea of what they needed. They weren't asking us to develop a Taj Mahal. They were asking us to develop something that was actually needed. And most importantly, the health minister committed to providing the necessary staff and paying the salaries of the medical folks that would be working in the center. We went on to have some community consultations. And that was actually a really interesting process as well. We met with a number of people in Deborah Burhan. We met with priests, with farmers, with laborers, with teachers, with women's groups. We also met with some of the local officials. And they spoke passionately about the need for proper health care. As Shelly said to you, the closest, basically the closest medical center was in Axum, which is at least 2 hours walk away. And so just imagine for a moment that people have minor illnesses, whether it's rabies, and they're dying because they simply can't get any medical care. And that's something that the health clinic can obviously prevent. We also began to develop some important partnerships. That was part of our assessment. And I'm going to talk about those briefly. One is there is a university in Axum, quite a modern university going through a massive construction phase right now. And we spent some time with the Vice President as well as the Dean of Health Sciences. They do have a new medical school there. They agreed to partner with us by committing to send some of their medical students to the new health center if and when it's built. And to help strengthen our relationship with them, what we did is we provided them with some water filters. We brought along some Sawyer water filters, which some of the clubs out here I know quite well, and showed them how to use them. And they committed to having their medical students use those water filters and take them out with them to some of the rural areas. So we know that even as a result of our assessment process, we're actually impacting some of the lives already in the rural areas, even outside of Deborah Burhan, which is something to be proud of. So we know that the university is willing to partner with us. We also spent some time with the Rotary Club of Addis Ababa East. Addis Ababa is the capital of Ethiopia. We talked to them about why we're here, laid out the project for them, and even before us asking, they offered to be our partner club for a global grant application. So they're quite experienced in global grants, and they're quite anxious to be a partner of ours. We also, through the efforts of Mike McCullough over here, we were able to touch base with a gentleman who was the district governor-elect. He is the district governor-elect, so he'll be Wayne Titus's classmate. His name is Tashomi Kabede, and he's from the Addis Ababa Bole Rotary Club. He was so interested in supporting the health center when we heard about our project. He actually, on his own dime, flew up north and spent some time with us, viewing the proposed site and talking to local officials with us. And so he's made a commitment to help us in his capacity as district governor very soon in any way that he can. We also, on our last evening, actually, we spent some time in Axum, and we hosted a dinner for over 35 people made up of municipal and regional leaders, business leaders, university officials, school officials, ostensibly to thank them for participating in the assessment process, but also to plant the seeds for the development of a new Rotary Club in Axum. And we're very excited that the discussions still go on. There seem to be quite a few of them that are interested in doing that. This, of course, would be very beneficial if we do develop a health center there to have a local Rotary Club. There's no Rotary Club nearby. The closest one is about 3-4 hours away. Rotary is quite active in Ethiopia, but most of it is unfortunately in the capital center and not in the northern area where we are. Last two things I'll talk about. One is the location, and you can see it there on the screen. The location of the land has already been selected. It's a plot of land of about 100 meters by 100 meters, so almost 2 football fields in size, and has been donated by the villagers. Now, this is a really big deal because this is a farming village. This is how people make their livelihood, is by farming. And so land is extremely important to them. So for them to donate the land to us for the project is a really overwhelming statement that they are willing to be a part of this as well. A road has also been built already to access the land, and hydro and water are nearby, which is obviously very important for a health center to be erected there. So what did we learn? Well, we learned a lot more than I can possibly say in the 3 minutes I have to tell you about it, but I can tell you at a very high level, we learned that absolutely a health center is needed in Deborah-Burhan. It is going to save lives, there's no two ways about it. What is needed is exactly the same sort of model that they have in the rest of the country, which is a 6-block structure that will provide basic medical services. As I said before, the Ministry of Health is going to provide all the ongoing operating costs, so really our responsibility would just be to get it up and running. The cost is estimated at about $500,000 US, and as I've already said, we'll have many, many partners. So I'm going to turn it over to past District Governor Donna Schmidt to tell you a little bit more about next steps. Thank you.
Good morning. So, what are the next steps? Here's what you already know. The people of Ethiopia have provided the land for the health center. They've agreed to build an access road and to drill wells to allow water access to the proposed site. They've made a commitment to staff and train medical and non-medical personnel, and have promised to provide local labor for the building of the health center. We have formed partnerships with the Rotary Club of Addis Ababa East, the University of Axum, and District Governor-elect Tashome Kabedi, who is from the Rotary Club of Addis Ababa Bowl in District 9212. We will also be partnering with Michael and Shelly's District 7010, which is located in central and northern Ontario. Closer to home, we've had discussions with Chuck Howie from the Rotary Club of Trenton. Through the generosity of the Charles and Dee Howie Family Foundation, we have received commitments of over $200,000 to support this maternal and child care project. We are currently drafting a global grant proposal that will be forwarded to Rotary International. This proposal will request funding for medical supplies, equipment, and non-construction projects for the health center in Deborah-Burhan. As you heard earlier, the projected cost for the health center is $500,000. At this time, we have raised over 40% of the total amount required for this project. Our greatest challenge, however, is still ahead of us. Construction costs are not covered by Rotary grants, and matching funds are not available for building projects. We are asking for your support in helping us raise the additional funds that are needed for construction of the 6-building health center. If your Rotary Club or members of your Rotary Club are interested in supporting the building of this health center complex, please contact any of the members of this team, and we will be happy to discuss the possibilities with you. Ethiopia is a democracy with a stable government. Our longtime commitment to this area has provided us with relationships that are based on mutual respect and trust. The people in Deborah-Burhan are good people. They are honest, hardworking, and kind. When they tell you that they will do something, their word is their bond. But because they are poor, and for no other reason, women and children are dying of diseases that are readily curable if medical support is available. This health center will provide services to 25,000 people in the northern region of Ethiopia. As we move forward into the 2015-2016 Rotary year, what better gift could we give to the world than the gift of life? Please join us as we take the next step into service in Ethiopia, and don't forget to wear sturdy shoes. Thank you.